Good morning, Peter Goertz. I'm a psychiatrist. Self-destructive behavior. Should people have the freedom to self-destruct? Big question, in my opinion. There are medical aspects, psychiatric aspects, psychological, social, ethical, financial aspects. Very complex issue and very pertinent day-to-day issue in medicine and psychiatry, unfortunately. Recently, I saw two patients that brought this topic to my mind. One of them had been using IV heroin, had serious medical problems, needed prolonged hospitalization medically, and the other one, similar drug use, major medical problems, hospitalization, really serious physical issues. So some people may think these drug users are garbage anyway, they should die. But the reality, in my opinion, is they're like me and you. They're human beings struggling with various challenges in life, and often with very serious challenges. So in my experience, and for example, these two patients were both loving, complex people and a pleasure to talk with. So the type of thing we're talking about is not uncommon. Let's say an IV heroin user develops endocarditis, that's infection of the internal part of the heart, and needs prolonged ongoing IV antibiotic treatment in a hospital. That can take weeks and weeks, and then finally they're okay medically, they're discharged, and then what can happen is they use IV heroin again with a needle that may not be clean and cause the endocarditis, again, the infection. So that is a major issue also from a financial aspect, because that's a lot of money that was spent on medical care, and sometimes doctors can get quite upset with these patients. Not just money, time, effort. So we're talking about people, and we're all human. We all can do these things, at least at times, take risks, be in some way self-destructive, but I'm talking about people who do this chronically and in a quite dangerous way. So I'm talking about people who use drugs, alcohol, maybe food, to a point where it really causes physical issues. For example, there can be people who take major risks, so riding a motorcycle at very high speeds, that can be a major risk for someone's safety. Unprotected casual sex is another example. So there are various ways of taking serious risks that can have repercussions on one's life and including on one's physical health. So these people, let's say the example of the person I mentioned with the IV heroin use and endocarditis, is that person dangerous to themselves? Of course, in a sense, in a chronic sense. So do we want to hospitalize these people psychiatrically for a prolonged period of time so they can't be dangerous to themselves? Probably not, that's my opinion, or definitely not is my opinion, because these are ongoing issues that have deep roots, and I don't feel that psychiatric hospitalization is the right way to go for these patients. On the other hand, if there's on top of the chronic issue, an acute issue, if they're hearing voices telling them to kill themselves, and that can happen from drugs also, if there's an acute issue that they need psychiatric hospitalization for, of course, that's another story. But these chronic issues, I don't think psychiatric hospitalization is the solution. And analogously, incarceration in jail or prison is another option. And both happen. I mean, prolonged psychiatric hospitalization, not, but Incarceration definitely can happen with people who are self-destructive, and that is punitive, and the people may not get treatment in the jail or prison. And we're talking about people who need, in my opinion, long-term treatment, including long-term psychological treatment. These are people very often who've been sexually and or physically abused in childhood, have encountered other trauma in their lives, like trauma from combat. So we're talking about long-term underlying psychological challenges that are under the surface of the so-called self-destructive behavior. And that requires a lot of effort and long-term treatment, including long-term psychological treatment, if the patient is even agreeable. So, bottom line, as often, there's no easy solution. There is another way of looking at it, though, as far as prevention. So if we can psychologically and socially create a nurturing environment for our children, for all children if possible, that may well go a long way to preventing self-destructive behavior of children or of people. Thank you.